Hi, my name is Mairead Loftus, Specialist Coordinator in the Centre of Nurse and Midwifery Education, Castlebar. And you are very welcome to our Inclusion Health Voices from the Margins podcast series. Today I am joined by Clodagh Moore, Clinical Nurse Manager to Social Inclusion, Integrated Health Area, HSE, Dublin and North East. And later we will be joined by Clodagh's colleague Paula McLoughlin, Social Inclusion, Roma Liaison Officer. Hello Clodagh, you're very welcome and we're delighted to be with you here today in Summerhill Primary Care Centre in Dublin. Clodagh, you've a role, I suppose, that for many is new in the country. Can you tell us a bit about it and how you got into it?
Absolutely. So my background is nursing. So I was a public health nurse in Dublin North Central for a long period of time. I had a keen interest in social inclusion from being a public health nurse in Ballymun and Dublin city centre. I met a lot of families that would be quite marginalised families and that just needed the extra support. I felt as a public health nurse, it was very hard to get the time to give those families the extra support that they needed. So I looked into a role within social inclusion. So my role now is within social inclusion. So I'm a clinical nurse manager, coordinator with social inclusion. So that gives me the time to work on a broader range of issues with families that need more support.
And can you tell us, what does a typical day in your life, working life, look like?
So every day is so different. My remit is meant to be traveller and Roma families, but I would work across a broad spectrum with social inclusion. So when I say social inclusion, it's basically anyone that needs more supports, whether that's because they have disabilities, because they have addiction issues, because they're homeless, or they're a minority family, like a Roma family living here in Dublin.
And when we talk about what your role is meant to be, Roma and travellers, can you tell me a bit about that work?
Yes. So I suppose Roma and traveller families are grouped together, got to do with the National Health Strategy for Traveller and Roma Health. It's a health action plan. So both Roma families and traveller families are both minorities here in Ireland and across Europe. So those families would need more support in relation to everything. So I suppose from a nurse perspective, there's a lot of cultural difference with a family from Roma, for example. Education wouldn't be the same perspective that we would have here. And health. So from a nurse perspective, a Roma family, the health education you would need to do would be really, really different. So Roma families would have a different way with newborn babies. For example, with measles, a Roma family may believe that the child should be kept really, really warm and should wear red clothing to help protect against measles. Whereas in Ireland, we'd be like, no, there's a vaccination that can really help with that. So it's about breaking down the communication with the families. It's about being aware that the health information I'd give to an Irish mummy who could speak Irish, could speak English, or who could read is very, very different than the information I need to give to that Roma mummy. So it's about changing the way that nurses practice to meet the needs of the family. And it's breaking down barriers, invisible barriers that are there for a Roma family or a traveller family to access the health services that we provide.
And just with regard to Roma, just from talking to you earlier, you mentioned about people can be moved. The Dublin Regional Homeless Executive, that many families are accessing support for, that they can be moved and that can have an impact on their daily lives.
So it has a massive impact. So for example, if a Roma family arrive in Dublin, they could have been moved from Longford, for example. So when they initially present in Ireland, they could be living in Longford and then they're transferred up to Dublin. And when they arrive in Dublin, they need to register with the Dublin Regional Home Executive, and that's in Parkgate Street. So that family then has an option from DCC. So they can either present as homeless and register as homeless, or they can live with family members here in Ireland. Some Roma families, for the lack of trust and they wouldn't be aware how to access the services, they may choose option A, which is that they're living with family members. In real terms, what that looks like is a small apartment and there could be 3 different Roma families living in it. Each family could have a number of children. For families that do register as homeless, present as homeless in with the Dublin Regional Home Executive, so that family could, for example, be housed in Kildare. They may have their children in school in Dublin. So it means that that family need to travel from Kildare to Dublin every single day. They could need to leave Kildare at 6 a.m. to get their children up to school in Dublin. And they spend the whole day, 8 or 9 hours, hanging around Dublin, waiting for the children to be finished in school. What that means, if they have a newborn baby, for example, they don't have the option to do one-to-one time with that baby. They don't have the option to worry about tummy time. They don't have the option to prepare food for weaning for that child. So it's basically families that become invisible here in Dublin, spend the day on the streets in Dublin through no choice of their own. So the Dublin Homeless Region Authority can move people in and out of accommodation for whatever reason. It may be that the room doesn't meet their size, or maybe that the private accommodation owners want the room back for multiple reasons. So that family doesn't have an option where they live. They don't have an option where their children can go to school. They don't have an option to make roots or to become established in the community. So they're living week by week in that accommodation. And that has a big impact on their physical health, their emotional health, and their overall well-being.
You mentioned there, Clodagh, that sometimes, your remit is Roma and Traveller, but you can span out to others. So is that the general homeless population, or is it predominantly the Roma and Traveller that you're dealing with?
No, it can be the general homeless population too. So if a family come to look for support, if they arrive in the social inclusion hub and they're looking for any kind of support, we'll help them regardless of what nationality they are or where they come from. So it could be Irish homeless families as well as Roma homeless families.
Okay. You talked about the tummy time and all those things that we naturally do for our children when they're small to actually bring on their development and the whole attachment piece as well. Is there a difference between the under 5 age group and the over 5 age group? I'm just thinking policy.
Absolutely. There isn't. So there's two different aspects to that question. So one would be for, as a nurse, the information that we'd give our families and homeless services. We need to tailor make our information to suit them. So it's very unrealistic as a public health nurse to tell a mum to do an hour of tummy time throughout a day, to blend a dinner, and to give an information booklet, to give like the standard HSE booklet to that mum. So we need to think, A, is it in a language the mum understands? B, can the mum read? So I suppose our health information needs to be changed and we need to make it accessible to the cohort we're giving it to. So for children under 5, within here in Dublin, if a child is in homeless accommodation, the public health nurse is notified. If the child is moved accommodation, whether that's the Dublin Regional Homeless Executive or whether that mum is lucky enough to find somewhere else for her home, the public health nurse is notified, which is really, really important. So the nurse can continue to support the family. For children that are over 5, unless they have additional needs or they receive health services for a child, just say with autism, or a child who's spina bifida and needs a hospital bed. Unfortunately, for children over 5, if they don't have additional needs, they're not linked in with the public health nurse service. So we can't track them and we can't offer the child and that mum extra support that they need. And that's where we fall down within Dublin. For children who are over 5, if they're over 5, the public health nurse doesn't know. So who knows if that child has been moved accommodations 3 or 4 times. If the child's not in a school service, who knows? So I suppose this is a massive policy issue in Dublin that we need to address. It doesn't necessarily fall the responsibility of the schools because they don't know about that child. And that's where we have our invisible homeless children that we just really need policy to change to make sure that every child is meeting all their needs and is somewhere safe and gets access to all services equally. And it brings it back to equity as well. So children that are in homeless services and their families, they need more support than families that are not in homeless services. So to make our service more equitable, we need to have better policies and procedures in place for children of all ages that are homeless.
So what you're saying is if they have no need per se, obvious need, that when they're over 5, basically there's a possibility, there's a risk they could fall through the cracks if they're not attending school or don't actively seek out healthcare themselves.
Yes. So when the child is over 5, unless they need to be linked in with a public health nurse or linked in with the Link Clinic or any specialised clinics, they're discharged from the public health nursing service. So there is no other service that provides a similar role to the public health nursing service. So those children do become invisible if they're not in a school place. Sometimes if they're in a school place, the school may think that they've moved on to a different area because that child could have been in 5 or 6 different school places. So schools can't continuously track where that child is as well. So it's really tricky.
You mentioned the Lynn Clinic, and then one of our earlier webinar series that we did on trauma informed practice. Where do we begin? We had the Lynn Clinic on. Can you just tell our audience, those people who aren't familiar with what the Lynn Clinic is, Can you explain just briefly, I suppose, what the Lynn Clinic is?
So the Lynn Clinic is an amazing service and it's headed up by Avian Walsh. So the Lynn Clinic is a GP service and it's an arm of Temple Street, really. So that's a children's hospital here in Dublin. So it's basically for minority families or children with complex needs that don't meet the normal criteria. So if you have an appointment on the Monday and you turn up at a typical children's hospital at 10 and your appointment is at 9, it's going to be tricky to get your child seen. If you turn up to the Lynn Clinic, you've got the right day. That's absolutely brilliant. So we've got child play therapists that are there to play with the child. There's translation services, and the advice and instructions that are given are made for that family. So they break down the barriers about language, about communication. It's just a really inclusive service for those children that do need extra care within the community.
And it's in the spirit of a great Mayo woman called Dr. Kathleen Lynn.
Yeah, Kathleen Lynn.
Which is great to see. When yourself and Paula were talking to us earlier, you were talking about bags.
Yeah. So what's really, really stark, so if a family is going into homeless accommodation for the first time, they're very naive. They've got many bags. There could be even 20 black sacks. So for example, they could have been put out of accommodation on the Saturday evening. Monday morning, they'd arrive and we'd meet them and they could have 20 bags full of all stuff. They'd have like their children's teddies, they'd have winter clothes, they'd have summer clothes, they'd have absolutely everything. And it's so sad and heartbreaking when you meet that family a year later, still in homeless services, they're down to 2 bags. They know what's essential and they've left so much behind. So it's the physical possessions they left behind, but they've also left behind the confidence that they're going to be home, they're going to be housed in a short space of time. So each time they move between a different accommodation, they lose some of their value, they lose some of their self-worth, as well as some of their possessions that people would take for granted.
And their memories.
Their memories change, their hope and their visions as well change. And instead of having extra bags with all the children's teddies or the children's summer clothes, they have more adverse effects though for their children. They have harder obstacles to climb and to come across.
I'm a bit speechless there, when I think about my own children, and I'm looking around the room here of my 2 colleagues, their own children and teddies, a bit speechless when you hear, the bags becoming tighter. I mean, that really brings it all home, the visual impact of homelessness. So you're meeting all this adversity and this is part of your everyday when you come into work. What keeps you going and what keeps you so energised? Because I'm actually falling over with the energy that's coming from you and the passion for your work. What keeps you going?
It's the small wins. So it's known that we were able to help that mum. It's people from marginalised backgrounds like the Roma community trusting us. So it could be as simple as we're walking into Summerhill Health Centre and there's a Roma mum, and she comes up and says hello to you and she smiles and she remembers your name and she knows that I know her name, that I know her children and that I've helped her. So it's knowing that people trust us to help them and to make them differences, and knowing that we can bring the services together to make the difference. And things that are small to us, it could be making a phone call to find out about a medical card application that's going to have a big impact for that mum, for that child, for that family unit. So it's just being able to help people and to make the difference by having the trust and rapport with people in the community.
Trust and rapport that consistently comes up. How do you build trust?
By being there, by turning up and just being honest with people and treating people, like looking past the fact that this woman is here with all the children and the children are crying and there's this going on and that going on. It's looking past that and realising, well, actually, that's a person and she's a mum and she's doing her best and it's absolutely amazing that she's here. So it's seeing people as the person that they are, and it's looking around and it's blocking out all the noise that they didn't attend to appointment or that they didn't do this. It's just the small things that they're doing and realising, well, actually, they're doing brilliant. What can I do to help them in this situation?
So you very much see that you're there to support and scaffold them.
Absolutely. And it's about linking them in with services. It's about using our connections, our translators, our public health nurses, our pharmacists across the road. It's about just bringing all the services together to empower that family and to help that family.
And to smooth the way for them.
Absolutely.
I'm getting very excited here, and I'm looking at Cora and Annette and Alan, and we're getting very excited because I think, you're going to bring us around for a little walk around the city. And it's excited in a very positive way to see the services that you're offering.
Great.
Okay, thank you.
Thank you.
We're here on Gardner Street. Annette, there's the mobile health unit that the Clodagh was talking about. It's a white van, social inclusion at HSC 017785168, and the logo. I wonder, are the girls there? We'll give it a knock and see.
Hi, Mairead. How are you?
Oh, Jesus, Clodagh, how are you?
Good, good. Do you want to come on the bus?
Ah, yeah, love to. Yeah.
Paul and I are just out here doing our Roma outreach on our bus this morning.
Okay, Paula, lovely to meet you.
And you, welcome to our bus.
Can we sit down for a minute?
Can, of course.
Can you tell us just a bit about your morning here on Gardner Street and the role of the bus?
Yeah, so the role of the bus is a great addition to our Roma support work that we do here in the northeast inner city. So we have our advocacy clinic up in Summerhill and our free GP clinic in Summerhill on a Monday, and then we have at least one day then during the week that we head out in the bus. And like you see this morning, we literally pull up on the side of the road, open the door and get out and just chatting to the Roma community, or to any community, anybody really that comes along. So we're here probably just 15 minutes now this morning, and we've already had a variety of different issues. From two ladies we spoke to, one was around housing, one was sexual health, and then we had a gentleman looking for advice on how he's going to do his laundry because the accommodation he was sent with doesn't provide that service.
And I saw that man just as we were walking up.
Yeah. So, and again, so that gentleman wasn't part of the community that we were targeting this morning, but people see our HSC logo and they'll ask for advice. So this morning we just gave him a QR code to send off for his STI tester kit, and he's going to look after that himself.
And I see there's just the door there, there's a clinical room in there. What would you use that for?
So our clinical room we'd use for loads of reasons. So we just say, for example, we had a Roma mum and she had sore in her leg or a sore in her foot. Sometimes our Roma women, especially, the footwear they wear would not be the most appropriate or most suitable, and they may have diabetes. So we would offer them a foot check as well to find out if there's something on their foot that could be causing pain or issues. So it's just to make them more comfortable. So obviously there's a door here on our bus that goes into where we have a plinth. So there's privacy. There's somewhere comfortable and somewhere safe where you can lie down and we can examine their feet if required. It's also a really handy place if there's two people and I can help one person in the back piece and Paula can work with someone up here in the front piece. So it offers confidentiality on our mobile unit as well. So we've all our presses here and we've all our stock. So as you can see today, we've got like our shampoos, we have our hygiene pads, we have toothbrushes. So we've different hygiene products that we would give out to the Roma community when they need. We've different information as well that we'd give out. So we have used our mobile health unit and we've attended a couple of different Roma populated areas, churches and events, and we would offer free health screenings as well. And that's kind of to build up the trust and the rapport that we spoke about, which is so key within the Roma community. So that's what we do on our mobile health unit, but we're a high visibility unit and we're working around the northeast inner city areas. And look, people, they know the bus, they know Paul is going to be there, Clodagh is going to be there. So it's just about saying trust, relationship within the community.
And Paula, from your perspective, what are the benefits for the Roma community then? Like, have you seen minor gains with the mobile unit?
Yeah, well, it's access. So as great as our clinic is, the advocacy clinic and the GP clinic, if those times don't suit people or if they're at work, they know they will catch us at some stage during the week. You know, they have access to us. You know, everybody in the community would have our numbers at this stage, but they know they will see us in town at some stage during the week and they can pop on. So whether it's a big issue or a small, again, they know they have the safe space, come into the van, shut the door. They have their examination room there if it's something a little bit more needs a little bit more privacy, or just a safe space sometimes to have a chat, to be away from the family. For particularly the Roma women, the families can be quite big, so for somebody to be able to come and meet us here, maybe when the children are at school, it gives her that space to have that time for herself and access to information. And like we said, we have our hygiene packs and that here, but we have information, health literacy on everything from diabetes, heart health, everything.
So that's a big, the early intervention piece as well.
Early intervention, yeah.
And health promotion as well.
Health promotion is a huge part of what we do. Yeah.
And what is there any challenges with the health promotion, we'll say, with the Roma community with regard to your health literacy piece? What would that look like?
So the health literacy, the HSE have fantastic resources online, and we would have hard copies of everything here in the bus. But sometimes literacy is an issue.
Okay.
So and it has been developed, a lot of the information now comes with a QR code. So again, they can go off with their QR codes and scan them and watch a video with that, that the translators have developed. Or we do, if we find there is an issue that's kind of coming up, again, with people, and if they're struggling with the videos, or if the literacy is an issue, we set up focus groups where we will have a service come meet a group of people with a translator, and they've worked really well. We've had those with the schools, nurses, Irish Heart Foundation, early education pieces presenting to the families, and it works really well.
So it's a very much a community-led, personalised service. So you're not telling the community what to do, you're being guided by the community.
Yeah, most definitely. Yeah.
So it's really patient engagement, PPI sort of model.
Yeah, most definitely. And we'd have great relationships with the other services that are looking after the Roma community in the area, with the schools, after schools clubs, some of the community centres. So it's everywhere really. It's a community approach.
Who came up with the concept of the bus? Or where did it come from?
Was so Paula and I are really, really keen about making our service accessible for all. So we brainstormed it with the manager of social inclusion, Brian Kirwan. How could we make our service more accessible to the community? And then what about a mobile health unit? So we said, absolutely, we'll try it. So this is a brand new initiative that we've set up within social inclusion. So it's a brand new initiative, and it's about making our service accessible to people in the community.
So you say that if people don't make, your GP clinic and your empathy clinic, that they'll meet the bus. But how do they know where to find the bus?
They'll ring and ask. Yeah.
Okay.
Yeah. And then, because we're so visible within this, like I'm looking out the window here and I can see 6 or 7 accommodation services. So we would know the staff in the accommodation services. Very often they'll get in touch. We work very closely with Danute, who is the translator on the Roma info line.
I think we're meeting Danute later.
Yeah, great. And any questions, the community have a fantastic trust in Danute because of the work that he has done over the last number of years. So if Danute feels that a query he gets is something we can address, and very often that's how connections are made. But we're here 15-20 minutes. Word will kind of get around town in the next little while. The bus is there and people will just present, people will turn up. So when we pull up, it might be quiet for the first 15-20 minutes, and then people just arrive.
It's fabulous. I mean, it's fabulous. But you mentioned Danute there, and he's your link with the community.
Yeah.
So is it a lot about creating that connection and building trust and consistency, or how does that work?
Yeah, so it's very much earned, and we really acknowledge that. So if it's somebody that we haven't met before, it's baby steps on both sides. So again, we would very much allow the person to lead and ask the questions. So we might meet somebody 2 or 3 times before the real issue is brought up. So it might be then around contraception or a serious health issue that they feel they have that they haven't addressed in the past, and they might just build up to that over 2 or 3 visits. And once the trust is built and the work is put in, it kind of then just happens organically. It develops that way. But it's a lot of it is trust. My past experience would be within the homeless services, so I would know a lot of the Roma community through, when they would have been with us in accommodations. So I've already kind of got that. My name is out there, that I'm somebody that they can trust.
Okay.
And that's been usually beneficial.
Yeah.
Yeah. And that's really important, because as soon as your name is not good, it's a brick wall, it doesn't work. Yeah.
And that's fair enough. I think
100%,
it's the same for all of us,
most definitely,
isn't it?
Yeah, most definitely, yeah.
And especially when you're in a vulnerable population.
Yeah. Yeah, and the women in particular meet so many barriers, whether it be financial or how they're viewed in society. So to meet somebody that represents a service and can give them access to that, whether it be healthcare or just a sense of agency, I suppose, for themselves is, can be very, very empowering. And the women react very quickly and very positively to that. Like, we will have interactions with women who will be, will present as quite timid, and then within a couple of weeks and suggestions and, interactions, you can see their kind of belief and their confidence in themselves, because they're powerful women. Like, they're doing amazing work and managing as best they can with really limited resources. So they're very much to be applauded and admired.
So they just need their experiences validated and...
Yeah. Validation is a huge part.
And to be
recognition.
valued.
Yeah, huge.
Paula, it's just such a broad service, isn't it? And you seem to have so much knowledge and compassion and insight into the Roma community. If you were to say to any healthcare professional that's coming into contact with the Roma community, what advice or what guidance would you give them from your experiences?
I think it's really important to meet people where they're at. No assumed knowledge, so we can't assume that somebody knows about, autism in children or diabetes or what is considered a healthy diet in terms of heart health. And just to be very open and ask people how you can help them and what they would like you to do to make their situation that little bit better. And to go and find the resources that are in the community. So whether that's reaching out to your local primary healthcare team, your public health nurses, your social inclusion team, it's making the most of the services that are available, because they are there. It's just a matter of connecting people to the benefit of everybody.
You said there about, seeing the person. So in your interaction with, we'll say, a Roma woman, on a one-to-one, what does that look like?
Very often you need to see yourself as a woman speaking to a woman, or a mammy speaking to a mammy. And, we don't love our children any more than anybody else loves their children, or we all have the same worries, we all have the same concerns and the same hopes and admiration, goals for ourselves and for our children. And it's to realise that and to see them as, regardless of community or where they've come from or their social standing, it's to see everybody, it's to humanise everything, and see the person. See them as a human being. Yeah. And people react very quickly to that. We all like to be acknowledged.
Yeah. And show compassion and all of that.
Yeah, most definitely. Yeah.
And Clodagh, have you anything to add there from your insights?
No, I think Paula explained what we do really, really well. And I suppose the one take home for anyone listening to this would be just be kind, be compassionate and be considerate, and put yourself in someone else's shoes and think, what did it take for that mummy to do this today, or what did it take for that daddy, or what other problems they have going on. But then also to reach out to the wider healthcare team and look for help. Link in as many other healthcare professionals as you can, but just kind, caring and compassionate.
Thank you. I'm just in awe. I think the whole team of us from the CNME, the production team and Ellen, we're just in awe with what we've seen on Gardner Street and just this whole area today. I mean, it's a credit. Seriously.
No, it's great and it's lovely and we do have great fun and it's, but it's like people will see, particularly in Gardner Street and here on the corner of Talbot Street, there will be, people will see groups of Roma women standing, but genuinely sometimes they just don't have another place to be. They may not have bus fare to go back to their accommodation and come back into the city centre to collect their children, and if there's 2 or 3 school runs, financially it's just not an option, and standing on the street corner, particularly in this weather, it's not anybody's first choice. So
how do you mean that they may not have the bus fare with the community? What do you mean by that?
So if a family are accommodated outside of the city centre and the children are going to school here in the northeast inner city, at one time they may have lived in Gardner Street or in areas local to the schools, but and demand on housing in the city is so huge, and across the country of course at the moment. But if a family are moved by the council outside the area and they need to commute, so they get a bus into the city centre, into school in the mornings, They will have financial support with that in by way of a leap card that's provided.
As in the bus card.
The bus card.
For those of us that aren't from Dublin.
Yeah, so your bus card and the travel will be covered. So for each child, they'll get a journey to school and a journey home each day. So 10 over the week. And mum or dad, whoever that adult is within the family, will have the same. But that means once mum arrives or dad arrives in the city centre with the children to school, they're in the city centre then for the day. Because financially they'll be limited. They won't have that luxury and that privilege of going home.
To come back in, because that will double their transport costs over the day. So we will very often see families that have children in primary school and secondary school. Mum will come into the city centre, bring the kids to school, and then the first child will finish at maybe 1:30, and they literally have to hang around the city centre. Limited access to fun, so it's not an option to sit in, you know, a coffee shop or whatever with a couple of coffees over the day. So they're on the street corners till maybe the last child comes out of school at 4:00, and then everybody heads home. So it's cold, and they can be very, very long days. So the visual, you know, like when I come to Dublin, I just see the mothers and the buggies, and I would have never known that story, I think, or any of the team. We wouldn't have known that story. So our impression would be very different.
Yeah.
So those mothers are actually trying to educate their kids, do their best in very challenging
education would be a huge priority within the Roma community. Really? Yeah. And I mean, I had a phone call last night with a secondary school here in town, and we're going to go in and do a piece of work with the staff, and it's just because the community, the students, the numbers are so big now, and it's fantastic. It's always been the case in primary schools, but we're seeing that now in secondary schools, along with like boys and girls. So like that's a huge cultural shift for the girls to be attending school up until like at least junior cert and beyond. So to see Roma girls going into transition year and starting the senior cycle programme it's amazing, and it's a huge win.
Paula, I just feel this sort of compassion. I see the tears in your eyes, the emotion when you actually talk about you know, this community that you're working with, and just thank you for the privilege of coming on the bus, Clodagh and Paula, and just sharing with us your experience of lives of population. Actually, you've changed our whole frame of reference with regard to the Roma community. So thank you for that. We feel very privileged.
Yeah, thank you.
Thank you very much.
Today's episode was produced by Miss Annette Cuddy, Director, Miss Cora Appleby, Specialist Coordinator, Nurse Tutor, Miss Mairead Loftus, Specialist Coordinator, Nurse Tutor, all from the Centre of Nurse and Midwifery Education, Mayo Roscommon, and Mr. Alan Meany, Radio Producer.